Welcome to this presentation titled Gambling-Related Disorders as Mental Health Disorder Diagnoses and Recommendations to Diminish Corresponding Symptomatology. My name is Dr. Joshua John Curry. I am the founder, president, and chief clinical director of multisystemic programming for Dr. Curry and Associates. Now, according to the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, gambling-related disorders are mental health disorders, and we are going to cover that throughout this particular presentation. And they do have direct correlations with substance use disorders as far as the impulsiveness, the symbiotism that corresponds with gambling related disorders, and the manner in which gambling, from a problematical perspective, not a social or professional standpoint, which we will cover during this presentation, but from a problematical, all consuming standpoint, how they do correlate with substance use disorder diagnoses. And again, we will cover that throughout this particular presentation. Professionally, I do have several professional credentials, each of which I am very proud of. One particular credential, and it correlates with this particular presentation, I do have a certificate of competency in problem gambling that was earned by the Pennsylvania Certification Board. I was very proud of when that particular credential was awarded to me, when I met the standards to be awarded that particular credential. I wanted to put this presentation together just to bring awareness to how problematical gambling can be. Just as though someone diagnosed with a cocaine use disorder, severe diagnosis, someone diagnosed with an opioid use disorder, moderate or maintenance therapy diagnosis. When it comes to the abuse of central nervous system psychostimulants, when it comes to the misappropriation and abuse of licit and illicit opioids, those particular diagnoses, characteristics of those diagnoses can consume your life. And in addition to that, they can either indirectly or even perhaps directly taint the lives of loved ones. The same goes with gambling, and this is part of the reason why I wanted to at least do my small part to bring awareness, to heighten sociological attention of the manner in which gambling can not only consume and taint, but essentially ruin lives. Gambling involves risking something of imperativeness in the hopes of accumulating something of what is perceived to be of greater value. And here's an example of that. Someone could go to a casino and they could feel as though that whether it's luck, whether they're in control, which we will cover during this particular presentation, they could feel as though today is going to be the day in which they can put their paycheck on the line, and they can be convinced that they're going to put their paycheck on the line. They're going to essentially gamble their paycheck because they've convinced themselves, or they're wholeheartedly confident that just this particular risk will be worth the reward, because they feel as though that they're going to perhaps double, to perhaps triple, or in some way just increase or accumulate a more sufficient monetary gain in comparison to their paycheck. Gambling becomes problematical when there is a development of substantial impairment related to their gambling engagements. Going back to this hypothetical scenario in which someone gambles their paycheck. I am not a financial specialist, so despite all the credentials that I have earned throughout my professional career, none of them corresponds with finances. So I wouldn't be someone that someone would sit with and work with as far as treatment planning from a programmatic standpoint, as far as the management of finances. But the little knowledge I do have as far as finances, I always encourage people, if you're able to, let's put a few pennies away towards savings, towards retirement. Most importantly, when you do get your paycheck, let's take care of our obligations first. Let's take care of all of the bills, whether that be rent, mortgage, electricity. Let's add groceries in there. Let's take care of everything first before we even buy anything. And we do deserve that. We do deserve those shopping sprees. We do deserve a tattoo if that's something that you're interested in. We do deserve to reward yourself with jewelry. We do deserve a brand new pair of shoes periodically, and there's nothing wrong with that. But what we want to do is be very, very intellectually sound with our financial decisions. And when we get that paycheck, I encourage people, the problematical gamblers in which I've worked with, I encourage people, if you're able to do so from a symbiotic standpoint, and a symbiote is an organism that attaches itself to a host and it essentially takes over that host. We as responsible, mature, articulate, intellectually sound adults, we understand that when we get our paycheck, yes, we do have to pay bills because unfortunately, a bill collector is not they're not going to prioritize. You have this psychological challenge as far as being a problematical gambler. Their job, their obligation is to make certain that you or we as a consumer that we are essentially paying our bills in a punctual manner, or if not, then we're going to have to face that late fee. When we're talking about getting behind weeks, perhaps even months, because of problematical gambling, that's one of the things in which correlates with becoming a problematical gambler, in which that despite knowing these particular consequences, which corresponds with a substance use disorder diagnosis, despite having awareness of correlating consequences, we still find ourselves either going to an establishment, going to a casino, making particular bets in which there is a perhaps diminished or very small likelihood of winnings being something that's going to take place. And we're going to dive into that later in this presentation. Even when someone who's battling problematical gambling, even during those circumstances in which they win, it's going to be very, very difficult for them to take their wins and just walk away, count their proverbial blessings, so to speak, and say, today was a good day for me. I came out on top. A problematical gambler is probably going to stay in that environment because of what's taking place, because of what's activated neurologically or neurocognitively. When they win, it's actually a negative thing. They're going to try to, in most cases, they're going to try to win even bigger, which could essentially result in them losing what they've earned and then losing what they came with. So now this is where recuperation takes place. The essential characteristic of gambling related disorders is an ongoing or recurrent maladaptive gambling behavior that disrupts personal, family, and or vocational pursuits. Going back to the individual who received their paycheck and rather than paying bills, they unfortunately gambled their funds away. This is where those personal relationships, this is where those family dynamics could be tainted because they're responsible for the groceries, they're responsible for electricity, they're responsible for cable, internet, they're responsible for rent, mortgage, they're responsible for cellular phones or telephones, whatever is applicable. If each of them are all applicable, they're responsible for that. So rather than tend to their financial obligations that correlates with the household dynamic, which corresponds with the family dynamic, unfortunately that symbiote in the form of gambling, that's where that takes over. And rather than take care of matters from a financial standpoint, the gambling takes over and the gambling is prioritized. You're even correlating that with vocational pursuits, whether we're talking education or something that's associated with career advancement or professional development, rather than prioritizing the time needed, whether that be an hour, 2 hours daily, focused on career development, preparing for that examination needed to advance to the next level, perhaps even taking on a managerial or supervisory or leadership position, rather than studying for that examination. I'm talking hypothetically, of course, that could be around the corner. Someone struggling with problematical gambling, they're going to take those 2 hours. They're going to say, they could perhaps say to themselves that all of my professional experiences should position me to do well on that examination that's coming up. So I'm going to take these 2 hours. And rather than just tying up any theoretical loose ends and take care of this responsibility and be wholeheartedly prepared and confident for the examination that's coming place, or perhaps even an oral interview with a supervisory panel. Rather than go through all the rehearsals and things of that matter, I'm going to take these 2 hours, I'm going to take these couple of hours, or perhaps even a few hours, and I'm going to go to an establishment. I'm going to go gamble, whether that be through a card game, through slot machines at a casino, or things of that nature. So this is the manner in which problematical gambling wholeheartedly takes over, taints, and perhaps even ruin someone's life. Throughout my professional career, I have worked with individuals I have facilitated groups. I have worked with clients with their loved ones during family counseling sessions. And I talked about, I'm not saying that it's impossible, but I talked about, I've worked with them as far as the formulation of realistic, specific, measurable, attainable, relevant, time-bound, short-term and long-term objectives as far as treatment planning from a programmatic standpoint. And I'll discuss realistically, is someone struggling with problematical gambling, are we going to obtain the aspired for finances and essentially retire and set our families up for generational wealth and financial stability? More than likely, that's probably not going to take place. But what will take place eventually, as the finances are depleted, as we're going into savings, as we're going into our retirement, as we're borrowing money from loved ones and associates, once all of those bridges are burnt, so to speak, once all of those theoretical wells run dry, that compulsiveness from that symbiote and that level of addiction, just like someone presenting with features of a substance use disorder, eventually we're going to have to feed that addiction despite not having the finances to do so. And one way to feed that level of addiction or that level of symbiotism is through criminogenic impulsiveness, is through criminality, having involvement with crime. Problematical gamblers may find themselves acting upon criminogenic impulsiveness to obtain money with which to gamble. There could be participation with forgery, fraud, larceny, embezzlement, and other property and white-collar offenses. And in addition to that, we could find ourselves involved with perhaps even violent offenses. We could find ourselves, we just spoke about larceny, so we're just talking about stealing. We could upgrade essentially and transition into armed robbery. And this is where things could become very challenging. We're talking about introducing a weapon. A weapon could be, in most cases, as far as with human beings, a weapon could be very convincing, could be extremely intimidating, and could be very compelling as far as positioning someone to ultimately do what you're requesting, what you're ordering. But when we, from a criminal justice standpoint, when we introduce a weapon into a transgression, now we're automatically positioning ourselves to experience reprimanding in a form of more extensive sentencing. I would like to, this particular presentation is focused on gambling, but one thing that I do as far as individual, group, or family counseling sessions, I present, particularly when this is something that's ongoing, I present all possible dynamics. I want to introduce us to an offense that's referred to as felony murder. Now here is something that, this is a scenario in which I'll give someone who's presenting with a gambling related disorder. We burnt all of our proverbial bridges, all of our theoretical wells have run dry as far as where we're getting money from. The sustainment of employment has become very challenging, if not virtually impossible, because of what's taking place, because of our preoccupation with problematical gambling. So now we've reached a point in which we've gotten our hands on a weapon, whether that be through the appropriate means with documentation, or whether that be through the streets or black market, essentially, where we just found someone, exchanged whatever we exchanged, and got our hands on the weapon. So we've decided, we came to the realization that we could steal a vehicle, we could steal an automobile, take it to this particular location. They will give us cash immediately for the automobile, and they will do whatever they're going to do with it, more than likely get it out of the jurisdiction, get the vehicle out of the state, and take care of matters on their end, something that we're not too concerned about, we're not associated with. They requested a vehicle of any kind, we have a weapon, so we've decided we're going to find what's referred to as a soft target by the criminal justice system. So what we're doing, we have our gambling related disorder. So what we're doing here is, we're going to go to a grocery store. We're going to find an elderly gentleman who's shopping by himself. He's going back to his vehicle. So what we're doing here is, we found someone who's going through late adulthood, which could correlate, which could find us presenting with various medical issues. But as you're struggling with problematical gambling, that's not something that you were too concerned about, if at all, particularly if that symbiote, which I mentioned earlier in this presentation, that symbiote is an organism that attaches itself to a host and takes over that host. So that symbiote is going to tell us neurologically, we're not worried about any health issues, we're not worried about anything. All we're concerned about is brandishing this weapon, getting this automobile, taking it to where we're going to take it to, and hopefully the finances and the money that they promised us, they're going to honor their side of the verbal contract. So we approach that elderly gentleman that's coming out of the grocery store. We have no intentions on committing any form of violence. We have no intention on touching the elderly gentleman. All we want to do is brandish that weapon, perhaps be verbally aggressive, just let the individual know, let the victim know that we do mean business, and at least convince him that you are in physical danger despite our intentions on not hurting this gentleman. Now keep in mind, the reason why I'm talking about this is I'm correlating this with the crime that's referred to as felony murder. Now the definition of felony murder is a victim with their victimization being attached to a felonious offense. They lose their life during the span of 364 days. And this time period varies from jurisdiction to jurisdiction and from state to state. So in this case, we're talking about, so we just perpetrated aggravated assault by brandishing a weapon. We approached the victim. We're talking about false imprisonment because whenever someone's in the presence of a perpetrator and they have a weapon brandished, this person is under the impression that they're not free to leave at their leisure. So now we just perpetrated aggravated assault. We just perpetrated false imprisonment. So now we're telling the victim that I will be leaving with your vehicle. So the victim is not touched. The victim willingly gets out of the vehicle, gets out of the automobile, and allows the problematical gambler, or in this case the perpetrator, to drive away. The victim is so consumed. High blood pressure, we have high blood pressure issues, we have anxiety related concerns, we have respiratory issues, we have heart concerns. So all of these matters are overwhelming the victim. So as the driver is going away, what's taking place with the victim from a health standpoint is not subsiding quickly enough, and the victim, essentially, with them being so concerned, they lose their life right there on the spot. So we're going to say investigations happen as far as law enforcement and the criminal justice system, and the perpetrator is tracked down. The victim was hospitalized but ultimately lost their life after a couple of days. And like I mentioned, as far as felony murder, in most jurisdictions, within a 364-day period of felonious crime victimization, the perpetrator could be charged with what's referred to as felony murder, which is the equivalent of murder one, or whatever the terminology is regarding the respective jurisdiction. Essentially, the hypothetical scenario I just gave us, that's the equivalent of someone grabbing a weapon, in this case a gun, grabbing a gun, identifying a victim, traveling to that person's location, whether it be their job, their home, pulling out their gun and shooting that person in the face a couple of times. So the incident, the scenario I just gave, as far as problematical gambler, that's the equivalent of first degree murder, or whatever the terminology is, depending upon this jurisdiction. And now that perpetrator will be facing reprimanding that's corresponding with first degree murder. And if we're in a state that has capital punishment, whether that be the electric chair, gas chamber, firing squad, hanging, or lethal injection, the 5 forms of capital punishment that are currently in practice throughout the United States of America, that perpetrator could be facing capital punishment. Now, we're not talking about plea bargaining or anything along those lines, but if they are in a state in which capital punishment is not exercised, they could be facing life in prison. All of this correlating with problematical gambling and the actions they were taking to soothe that symbiote, to soothe the psychological anguish they were experiencing because they were not able to obtain the monetary value, the monetary support needed to find themselves engaged in problematical gambling. Despite awareness that such actions may result in involvement with the criminal justice system, including potentially being told you will serve the remainder of your life behind bars or you will be facing capital punishment. The neurocognitive modification stemming from a gambling-related disorder diagnosis could cause an individual to wholeheartedly disregard potential consequences. And like I just mentioned, which could also include spending the rest of your life in prison or having a specific date and time in which capital punishment will be carried out. There should be an understanding that a problematical gambler may experience cognitive distortions, which could include denials, superstitions, a degree of empowerment, control over the outcome of chance events, and like I mentioned earlier in this presentation, overconfidence. They could feel as though that today will be the day that I will walk into this casino or this gambling establishment and things will go my way. Gambling related disorders oftentimes co occur with antisocial personality disorder or its adolescent juvenile counterpart, what's referred to as conduct disorder, which is generally diagnosed as far as from a diagnostic perspective. That's generally a diagnosis that an adolescent will receive. But antisocial personality disorder is the adult equivalent of conduct disorder. In addition to those particular diagnoses, gambling related disorders could co-occur with various depressive and bipolar disorders with correlating specifications, as well as with substance use disorders, particularly alcohol related disorders. Similar to other mental health disorders and addictive disorders such as substance use disorders, someone could experience genetic predisposition to gambling related disorders or be influenced by what is going on around them from a socio-economic standpoint. This is where I would like to just briefly discuss the nature versus nurture aspects of matters, with me mentioning genetic predisposition in conjunction with what's taking place with someone from a socio-economic or social economically. When it comes to mental health disorders, substance use disorders, just like we inherit our body type, our skin complexion, our hair color, our eye color, we can inherit cognitive behavioral characteristics, which could also include features of mental health disorders, including substance use disorders. And this also includes gambling related disorders. So we have a particular generation or generations from a familial perspective in which problematical gambling is something that takes place. That is a behavioral feature which could be passed down. And this particular generation, the latest generation, there could be genetic predispositioning as far as someone essentially being born with features of a gambling related disorder. Now, going to the nurturing side of matters, or what's taking place socioeconomically, we're living in an environment someone's born, so as far as genetic predisposition or not, we're living in an environment in which problematical gambling and corresponding activities is taking place. And this could include the association or the affiliation with characters in which are engaged in these types of mannerisms, these types of behaviors. Someone exposed, particularly on a consistent basis, someone exposed to this particular lifestyle, they could find themselves positioned from a nurturing standpoint. They could find themselves conditioned to become involved with problematical gambling. So we're talking about nature versus nurture, or nature and nurture, or genetic predispositioning, or what's taking place socioeconomically. There are an array of factors biologically and socioeconomically, and perhaps even sociologically. There are an array of factors in which could position someone to become a problematical gambler. This is reason behind why I wanted to put this presentation together and to at least bring attention to what's taking place. If we're gonna, I would like to present a young child, a young girl, 9 years old, and she's coming home from school each day, and she sees gambling, she sees card games, she sees money on the table. And this is something that's taking place. And when we're talking about those life lessons that are happening between parents and children or guardians of a child, we're talking about what's taking place rather than the adult expressing knowledge or expressing concern or interest as far as what's happening with that particular child academically or recreationally, or how she's progressing socially. lessons are being taught as far as gambling, as far as not only how to be successful, but how to perhaps even develop a system in which this particular person could at least heighten their chances of being successful. This correlates back with someone feeling as though they're in control over the outcome of chance events. When it comes to gambling, are we really in control? Or does, from a symbiotic standpoint, does the gambling take over you? So going back to that 9-year-old girl, she's being exposed to this. She's having these lessons taught to her. This could position her to become intrigued and to feed that symbiote essentially, as far as that symbiote becoming stronger and more compelling and more forceful, as far as this young lady at some point during her adolescent years or during her adult years eventually getting herself involved with gambling to the point in which it becomes unmanageable, overwhelming, and she's now a problematical gambler. Gambling related disorder diagnoses traditionally manifests themselves through persistent and recurrent problematical gambling behavior, resulting in clinically significant impairment, distress, or perhaps even dysregulation from an emotional standpoint. Such circumstances are generally indicated by the individual endorsing four or more of the following criteria within a 12-month period. And this is where I'm going to cover corresponding features of a gambling related disorder. The individual may find themselves needing to gamble with increasing amounts of money in order to achieve the aspired for level of excitement. So, going back to the person I mentioned earlier, hypothetically, that went to a casino or went to a gambling establishment with their paycheck. So they realized that gambling just with their paycheck is not something that's good enough for them anymore. So now, in addition to their paycheck, they're at home thinking about liquidation. What could I sell? Particularly with social media outlets and those particular platforms in which you can reach very large masses of people expeditiously. So within our homes, there are household goods in which may not be anything of value as far as sentimental for us, but we can post it on various social media platforms. We could immediately find a buyer. This is something that I've seen. This is something I've seen personally. I've not utilized social media very often in my life for those particular circumstances, but a couple of years ago, I was going through. I was essentially moving homes, and as I'm moving, as I'm packing up, and realizing that wow, there's a lot of items in my home that my family and I we just don't have any need for. And my wife had shared with me. She said we could post these particular items here, and literally within a couple of hours, everything that we posted, and there were quite a few items. Everything that we posted was we had responders and people. We had multiple responders for individualized items, and people quickly it came to our home with cash, and people were reaching out to us. People were notifying us saying that they were in the process of getting larger vehicles needed to carry the larger items away. And I was very amazed. This was my one and only time ever doing this in my life, but I was very amazed by something that I literally forgot was even in my home. Something that was buried in the back of a closet somewhere. Something that was buried in storage. Someone saw it posted online, and without seeing it in person, they were literally begging my wife and I to hold on to it, to promise them that they will be allowed time to go and borrow a larger vehicle, or even there were some instances in which someone was had informed my wife and I that they were in the process of renting a vehicle just to come and get the large item that they had saw online. The point I'm making is from a liquidation perspective to correlate this all with problematical gambling. This is a manner in which someone could increase the odds, so to speak. They could go to a casino or a gambling establishment and take more money. And this could be something that with them gambling with increased money in comparison to the past, this is something in which they could use or lean upon to achieve the aspired for level of excitement from a gambling standpoint. Such complications could position someone to experience restlessness, and irritability when attempting to reduce their involvement with gambling. I made mentioning of vocational, occupational, the fulfillment of those obligations early in this presentation. So we have someone sitting at work, and they have hours upon hours of documentation that they must fulfill punctually, and they've reached the realization that there's literally not going to be enough time for them to fulfill this obligation or tend to these responsibilities that perhaps were even quickly bestowed upon them. This was something that which we've all experienced professionally, that you think you have time to do this, and then all of a sudden you receive notification from the supervisor or perhaps even the counterpart that there's going to be that your assistance is going to be needed as far as coming together for your department, for your organization, for your institution, for your company to take care of this particular obligation. And that could be okay as far as you being a responsible professional. But if you're presenting with features of or you're endorsing characteristics of some sort of gambling related disorder, you were under the impression that you were going to have an hour perhaps that was approaching in which you could have utilized the internet or perhaps even left your building or left your office essentially to go to a gambling establishment. Now with these particular work related obligations, that time slot was taken away. So this is where a level of irritability could take place. This is where restlessness could manifest itself and grow tremendously to a point in which the problematical gambler could become overwhelmed. They realize that there isn't going to be sufficient time for them in the immediate future. So now we're talking about perhaps even hours upon hours in which we can get ourselves soothed through gambling. So this is where that level of attentiveness, that level of concentration, that degree of focus that's needed to tend to a respective responsibility, whether it's professionally related or occupationally related or not. If someone's struggling with problematical gambling, having their time essentially taken away is something that could be very challenging, and this could put them in a position to present with some form of passive, verbal, or perhaps even physical aggressiveness because they're not in a position to tend to their urge to have themselves involved in gambling. There could be very unsuccessful efforts to control, reduce, or stop gambling. Similar going back to a substance use disorder, someone going away for rehabilitative treatment. They've gotten themselves involved with Narcotics Anonymous, Alcoholics Anonymous, Cocaine Anonymous. They work collaboratively and consistently with a sponsor through sponsorship. They've kept themselves involved with outpatient substance abuse treatment. But despite all of those efforts, they still find themselves plummeting back into active addiction. And this is something that someone presenting with some sort of gambling related disorder could experience as well. They could go away to treatment. They can go away and they can work with peer support. They can go to a Gamblers Anonymous meeting. And just like with Narcotics Anonymous meetings and gatherings, there is sponsorship. They could get themselves involved in sponsorship. They could work with an addiction specialist, and we're not just talking about someone a a substance abuse treatment professional. We're talking about addiction in general, various addictions, including gambling, including sexually related addictions, in conjunction with substance abuse related addictions. So they're working with an addiction specialist. They've collaboratively gotten themselves involved with formulating treatment planning to at least control, reduce, or stop gambling. But despite all of these efforts, unfortunately, matters have been very unsuccessful for them. These circumstances may also find an individual preoccupied with gambling related engagements. Just like I mentioned with the hypothetical employee, was under the impression that within the next 45 minutes or so, they were going to have an hour or two, perhaps because of something, an appointment that was canceled, a meeting that was canceled. So they've gotten themselves ahead as far as with documentation. But then all of a sudden, another obligation presented itself. So rather than being that responsible professional, now they're struggling because they were so preoccupied with this upcoming time. They felt as though they were going to, in this case, we're going to say, get onto the internet, get onto a gambling site, and gamble away, get themselves involved with that. They were so preoccupied with that. Now that that time is approaching, has come, has passed, they were unable to just focus on what they have to from a professional standpoint. They're still occupied with what's taking place with this site. I could have won X amount of dollars. I could have obtained Y amount of dollars. Today would have been my day. This must be some sort of divine intervention, perhaps. And this is where someone could find themselves being convinced that this is reasoning behind why I should abruptly terminate my employment and I should walk away. Could this be divine intervention? Could there be some sort of spirituality? And this is something that problematical gamblers have experienced. They do experience, with them expecting this particular time that was approaching, that did approach, and that did unfortunately pass. They were in a position to fulfill an unexpected professional obligation. And this is where they could say, this is reason behind why I should terminate my employment effective immediately. Because they're so preoccupied with gambling. They're so preoccupied with the unrealistic expectation of problematical gambling supporting them from a financial standpoint to the point in which they've been convinced that they should terminate their employment effective immediately. Gambling could become a counterproductive coping mechanism, utilized for what could be perceived to be self-medication purposes when overwhelmed psychiatrically or psychologically, or perhaps even emotionally. Let's just say, hypothetically, someone's involved with a significant other. There could be an argument, there could be some sort of dispute, there could be some sort of or some form of disagreement, which does happen in relationships, including with between significant others. So in this case, rather than a person just going out for a jog, perhaps even journaling, working on some music, listening to music, going out for a drive, or even going to a gymnasium to involve themselves with weightlifting or some sort of strength training or cardiovascular activities, perhaps even removing themselves from a situation, tending to household chores such as vacuuming, sweeping, having themselves involved with laundering, including ironing clothes for the upcoming week. This person could say, I'm overwhelmed psychiatrically, I'm dysregulated emotionally. Rather than doing all of those pro-social or productive coping mechanisms or replacement skills that I just recommended or I just mentioned, I'm going to remove myself from the situation and go to a casino or travel to a gambling establishment. So in this particular case, from a counterproductive standpoint, as far as being a coping mechanism, a problematical gambler, when overwhelmed emotionally, psychiatrically, psychologically, or perhaps even some other, or in this case, features of a mental health disorder diagnosis presenting itself, or they find themselves experiencing some sort of episode, rather than go through all of those measures, rather than reaching out to a clinical practitioner, they make the decision, or perhaps even that symbiote overwhelms them and takes over them. Like I mentioned a couple of times early in this presentation, the symbiote essentially is an organism that attaches itself to a host and takes over the host. So in this particular case, the symbiote is activated or becomes alive or becomes strengthened, essentially, when the problematical gambler is overwhelmed or dysregulated psychiatrically. So this is where the symbiote feels as though the host, which is the problematical gambler, is weakened or is perhaps at their most vulnerable state. And this is where that symbiote makes the recommendation to travel to a casino or a gambling establishment. And this is where, from a coping standpoint, this is where the problematical gambler finds themselves involved with problematical gambling. After losing money gambling, a person experiencing problematical gambling may find themselves oftentimes perpetuating gambling to recover what is lost. This is something that I briefly covered early in the presentation, where rather than saying, okay, I lost $100, $500, $1,000, and of course, perhaps even more, rather than saying I've lost just about or more than what I anticipated, I should perhaps leave and learn from this lesson. The problematical gambler will remain in the establishment and they will exhaust all means, or they will make an effort to at least exhaust all means to continue gambling to at least recover what is lost. So if we're presenting with a gambling-related disorder, making the effort to recover what is lost could actually be counterproductive. It could be something that's negative because if you have features of a gambling-related disorder, if you are able to successfully recover what was lost, now we're talking about from a mental health standpoint with gambling-related disorders, according to the fifth edition of the Diagnostic and Statistical Manual of Mental Disorders. Could a problematical gambler successfully recover what is lost and merely walk away? Or could they view that as now luck is on my side? Now things are picking up for me. I've just recovered what is lost. Now I'm on a good streak. Now I figured out what was wrong. Now we're going back to the problematical gambler feeling as though they are in control over chance events. We're talking about, let's utilize a card game. We can be very intellectually sound as far as what to do when you're positioned, as far as what cards you receive, but we're talking about chance events. No matter how knowledgeable you are, regardless of what the card game you're gambling with, even in a setting that isn't professional, such as a casino, let's just say we're going to go play spades at the home of an affiliate or somewhere in which there was advertisement through notification through social media that there will be a spades tournament held and there will be money involved. So essentially we're gambling. So despite how knowledgeable someone could be of a card game such as spades, essentially we're talking about chance events. You could be very knowledgeable. You could even have a partner in which you work very well with, you've been working with for a long time. So we're talking about chance events. Despite all of those circumstances, you're still not in control of the cards that you are dealt. You could be dealt cards in which position you to be very unsuccessful and you could lose your money. This could happen hand after hand after hand after hand. So now, despite all of these chance events, you were dealt very poor hands. You've lost a lot of money. You've lost more than what you intended to lose. So now we're staying there as a problematical gambler in an effort to at least recover what was lost. And if we're able to do so, even in that environment, if we're able to do so, why leave now? Because a problematical gambler more than likely could feel as though that there's money to be won here. And there may periodically be fabrications resorted to. So the extent of gambling related involvement is concealed. What we're talking about here is we're talking about someone ultimately going through unfortunately lying to their loved ones, lying to their coworkers, lying to a supervisor. A supervisor could express concern over a problematical gambler coming back from their lunch break extremely late on a consistent basis. And even though the person isn't in any trouble as far as their employment being terminated, the supervisor could say to their employee, hey, I've noticed that you come back from lunch a little roughly a half an hour later than expected. I mean, yes, you're taking care of things professionally, but this is where the problematical gambler, rather than saying, hey, you know what, sir or ma'am, yes, that is true. I have come back from my lunch break about a half an hour later than expected. So despite my efforts to fulfill my professional obligations punctually, they could just say that yeah, there's a lot of traffic that takes place. I go to lunch here, I go to lunch there. Uh, the professional food preparation, it's not as quickly as I would like. So this is why I stayed later or I come in earlier if need be to make sure my responsibilities are taken care of. The supervisor could be okay with that and just merely leave it alone. But this is where an opportunity could present itself for the employee to tell the supervisor, I actually eat a sandwich and consume a can of juice. So as far as from a caloric standpoint, I'm good to go. But I go to a gambling establishment and I just essentially lose track of time. I set an alarm, I ignore the alarm, I ignore all of the indications that I've been here longer than expected because I've either lost money, I'm trying to recuperate money, or I've been winning. So now that I'm winning, as far as going back to work, especially because I came into the office earlier than expected, or I'll stay later, including working during the weekends. So I'll use all of those as justification to remain here at least a half an hour or perhaps even longer at the gambling establishment rather than returning to work. And this is where those levels of fabrications, concealment, or essentially even lying takes place because problematical gambling is ultimately positioning the individual to have it consume their life. It would not be an extraordinary occurrence for an individual struggling with problematical gambling to jeopardize or lose a significant relationship or educational, vocational, or career opportunities. I made mentioning of someone presenting with some sort of gambling related disorder earlier in this presentation. They received their paycheck, and rather than tending to the mortgage punctually, or perhaps even earlier, if we're able to, all of their funds were lost because of problematical gambling. And this is where we're involved with a significant other, we're involved with a spouse, and we're talking about a mortgage. So now we're talking about those mortgage payments not being made punctually, property taxes not being tended to. So now we have outside entities notifying us about ultimately seizing our home, seizing our property, seizing our land because of problematical gambling. And this is where a relationship with a significant other could be essentially jeopardized, if not terminated, because of problematical gambling. The significant other could feel as though that they have been lied to. They were under the impression that the mortgage was being tended to. They haven't checked because of that level of respect and trust of their significant other. But now we're reaching a point where one party may feel as though that they essentially do not have any awareness of who their significant other is because they're living this life ultimately that they had no awareness of. So, in addition to perhaps a financial management course that's being needed, rehabilitation as far as the gambling related disorder, potentially even couples counseling, there's a lot that's taking place here because of problematical gambling, not only impacting the life of the problematical gambler, but also their significant other. Now we're talking about perhaps even children and other loved ones who, depending upon the mortgage to be paid punctually or earlier if need be. This may result in the reliance upon others to provide financial support because of monetary strain induced by gambling. This level of reliance could cause, remaining along the lines hypothetically of someone presenting with a gambling related disorder, concealing their activities, concealing their struggles. So they're reaching out to loved ones just to borrow a couple of dollars here, perhaps even $100 there from this relative, potentially even $150 here, $200 there. So with all of these entities providing monetary support to help out with their loved one as far as their mortgage, because we're coming from a loving family, a supporting family. Under those conditions, loved ones wouldn't want to see someone lose their home, which should be around generationally. They wouldn't want to see anyone have their land seized, have their property taken away. So this is where the problematical gambler could say, matters are not really going well with me professionally. And this could be true, but they may not be wholeheartedly transparent as far as why. I've been I haven't been punctual with occupational assignments. I've been abusing time off policy and vacationing. I've been so focused on gambling or so overwhelmed because it's overwhelming me. Like I mentioned, gambling related disorders are mental health disorders according to the fifth edition of the Diagnostic and Statistical Manual of Mental Disorders. The gambling behavior is not better explained through mania, whether it be episodic, illustrating symptomatology subsiding periodically, or perhaps even persistent or ongoing, with the individual essentially experiencing symptomatology continuously, conceivably, or perhaps even lasting years at a time. And under these particular circumstances, with someone presenting with a gambling related disorder that is persistent, this is something that's consuming their life from an ongoing standpoint. We're talking perhaps even something that's daily or lasting throughout each day. They're so consumed, they're so overwhelmed by that symbiote that's correlated with gambling that this is where their life and the lives of those around them could become tainted to the point in which matters are jeopardized. In a clinical programmatic diagnosing environment, a gambling related disorder diagnosis with specifications could be substantiated. A gambling disorder mild diagnosis is associated with an individual presenting with 4 or 5 of the aforementioned symptoms that I just covered. When it comes to gambling disorder moderate, diagnosing could be substantiated through the presentation of 6 or 7 symptoms, and again, of the of what I just mentioned as far as someone presenting with some sort of gambling related disorder, as far as the problems of which they could experience. As far as a gambling disorder severe diagnosis, someone presenting with at least 8 correlating symptoms may perhaps meet criteria: hospitalization, including psychiatric, incarceration, or perhaps some additional degree of incapacitation could result in a gambling disorder mild, moderate, or severe diagnosis to be considered as being in some degree of remission. But this is something that should perhaps be assigned upon societal reintegration. So we're talking about a particular setting in which someone is not involved with any form of gambling. Perhaps cards aren't available. Perhaps there's just isn't anything of interest as far as the individual presenting with a gambling related disorder to get themselves involved with gambling. So under those particular circumstances, or perhaps even gambling is against the rules to the point in which it's so heavily supervised, if someone is involved in any form of gambling, they could be reprimanded to the point of wholehearted incapacitation. So if we're talking about being incarcerated, if there's a correctional facility, if correctional officers or correctional staff members spot or at least feel as though some form of gambling is happening, this is where administrative segregation could take place, and someone is ultimately isolated for days, weeks, perhaps even months or even years at a time, in which there's very minimal, very limited contact with other human beings outside of food and water and things of that nature being brought to brought to the inmates. As we're talking about a correctional environment, I'm not going to dive into the psychological anguish or perhaps even Eighth Amendment infractions as far as the Constitution of the United States of America being infringed upon as far as cruel and unusual punishment. But I have worked in correctional environments in which there were practices as far as someone violating rules, including gambling, including unauthorized gambling. I've witnessed personnel, I've witnessed individuals be essentially isolated for days, weeks, months, and years at a time. And there were efforts made to at least bring awareness of how that could hinder someone psychologically. And now we're talking about someone going through societal reintegration, being placed back among society with these perhaps even undiagnosed or untreated psychological challenges. So now we're talking about this person being released back among society. Now we're looking into an amplified or heightened likelihood of recidivism taking place, in which this person is unable, demonstrating an inability to function sociologically. So now they're back behind bars. But I'm not going to dive into that with this particular presentation, focusing on gambling related matters. Under such circumstances, from a specification perspective, environmental conditions could make access to gambling challenging because of restrictions associated with the surroundings, providing different considerations regarding an early remission or in sustained remission specification despite accumulated gambling related abstinence. And I wanted to use the term abstinence, which is traditionally correlated with substance use disorders, but like I mentioned, as far as an addictive nature, with gambling related disorders essentially being mental health disorders according to the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, just like substance use disorders are, such as a cannabis use disorder mild diagnosis is a substance use disorder, is a mental health disorder. I wanted to use that similar terminology because of the addictive nature as far as the term abstinence, with the addictive nature of gambling, similar to the manner in which someone presenting with a substance use disorder diagnosis, what they experience. When it comes to gambling related disorders with specifications, the modification of severity across time could be reflected by reductions or increases in the frequency and or involvement with gambling. So it is possible for someone to present with initially a gambling use disorder severe diagnosis. They've been presenting with 8 of the corresponding features. So over the course of time, upon an assessment, we'll say approximately 90 days apart. So now they're only presenting with 4 features. So now this individual has gone from endorsing a gambling disorder severe diagnosis to a gambling disorder mild diagnosis. These could present opportunities for someone being assessed as meeting criteria for an early remission, which is 90 to 364 days of gambling-related abstinence. Specification. Also, if time is allocated and in sustained remission, which is 365 days or more of gambling-related abstinence, specification could be considered outside of a restricted environment. And we're talking about a hospital, a rehabilitative setting, a correctional setting, a correctional environment, and matters of that nature. Once an individual amassed 365 days or more of gambling-related abstinence, so we're talking about specifications changing from severe to mild, or perhaps even going from mild to moderate to severe, and that's something that could happen as well. Going back to an assessment or an evaluation being conducted within 90 days, someone could present with 4 of the corresponding features, and they're endorsing a gambling disorder mild diagnosis. That number could jump up to 8 particular attributes within 90 days when the subsequent evaluation or assessment takes place. So now we're talking about that diagnosis being changed to a gambling disorder severe diagnosis. And also there could be times in which with particular abstinence, whether it's something that's documented or through self-disclosure, this could be a point where someone could receive an early remission specification, or hopefully one day and in sustained remission. And also just as easily, not as easily, but just as if someone could acquire an in early remission or in sustained remission specification being added to their diagnosis, those could also be removed as well through the admittance of involvement with contemporary or current forms of gambling. A gambling-related disorder must be distinguished from professional and social gambling, and I briefly touched on there being differences as far as problematical, social, and professional forms of gambling early in this presentation, but this is where I just wanted to dive just a little further into the differences. When it comes to professional gambling, risks are limited and discipline is essential. So these are individuals in which gambling has not consumed their lives. Gambling isn't something that's uncontrollable or unmanageable. This is ultimately their 9 to 5. And for those of us who do periodically watch television, we could see various gambling competitions. We could see people involved with and endorsed by an array of entities because of the amount of attention and the television broadcasting and the level of attraction to professional gambling. So as far as professional gamblers, and I'm not saying that a professional gambler cannot also live another life in which they're problematical gamblers, but we're just, for these particular purposes, we're just talking about someone who is involved with gambling as a profession. That is their identified occupation. So gambling isn't something that overwhelms them. They're able to fulfill family-related obligations. They're involved with their children. They're engaged with their significant other. They're trusted. They pay their bills punctually and early if they can. They're responsible for grocery shopping. Their loved ones are not concerned about them ultimately losing all of their money because of gambling. Transitioning into social gambling. Social gambling traditionally transpires with associates and lasts for a limited period of time with acceptable losses. I wanted to use a little self-disclosure and talk about a social form of gambling that I was involved in many years ago during my 14 years serving with the United States Army. I went to the Middle East as far as a combat deployment on two different occasions, once for 12 months and once for 15 months. My very first time there, I was, as an adult, I was involved with video games as a child very extensively. But as an adult, this wasn't something that I guess my level of interest just fell, or just didn't have time for video games any longer. But I was very involved with the video game of the football tournament, and these tournaments lasted just to give the service members something to do outside of operational functioning, just a little taste of normalcy, just a little taste of home. So I did get myself back acclimated as far as video games, and there were times in which very small amounts of money was was wagered. Money wasn't something because leadership wanted to abstain from any form of gambling because of the amount of anguish that could take place if someone were to fall into problematical gambling. So these tournaments, there wasn't anything on the line besides bragging rights and very small trophies in the end. But there were times in which, outside of tournaments, if someone were to have a couple of hours off, or perhaps even a day off, and they were to run across someone, whether it be an associate or someone they recognized from a tournament, there could be little friendly wagers put on the table. There was a time in which I was walking to grab some groceries, and I came across someone who I had not played yet in a tournament, but I knew he was in a tournament, and he had invited me back to his living quarters to play a video game. And I remember this very well. It was just a small amount of money. It was $20. We had wagered on the video game. Unfortunately, I did lose. I I did find myself to be very disappointed. I was very upset, not to the point in which anything was going to happen verbally or physically, but I was just very upset at losing. It definitely wasn't about the $20 I did have. I was very well off financially because of the situation I was able to position myself to be in. I did go back to the gentleman's living quarters, and I pretty much, I'm sure I was very friendly with it. This was many years ago, but I let him know that we are playing again. So in this case, we didn't play for money the second time around. So that told me that it was more of a competitive thing rather than me attempting to recoup the money that I just lost. So even though the second game that we played, there was no money on the line, I did win that time around. So that told me that it wasn't, looking back at that particular situation, it wasn't a gambling issue. It was a competitive thing as far as me. Like I mentioned, the second game, we did not have any money on the line, which is more so for bragging rights. I can say that this particular tournament did last a very long time, and even though that was an unofficial loss, and I didn't meet with him during the tournament, we were in different brackets. He was eliminated, and I did end up winning that tournament. And every time that he and I did see each other during our time, during the remainder of the time during the deployment, he would say that he was the actual champion because he beat me, but that wasn't during the actual official bracketing. So I told him that he didn't beat me when it counted. We didn't play each other. I told him that I did my job and I made it to the end. He didn't do his job and make it to the end, but he would share that he also had the victory over me. But I would counter that and say that, okay, you beat me, but I avenged my loss. But these, under those particular circumstances, there was a little social gambling taking place. There was, it only lasted a very brief period of time. There was an acceptable loss of $20. Nothing was attempted to be recouped or anything along those lines. It was more so for bragging rights. So that's the difference between social gambling and problematical gambling. If myself or someone under those same conditions presented with features of problematical gambling, they could have gone back and rather than play a game for $20, they could have said, you know what, we're in a position where we're very well off financially. We're receiving tax-free salaries. How about we bump that up to $1,000 or $2,000 over a video game? Under those particular circumstances, if that does happen, I've not known of anyone during my time during those two combat deployments in which matters a little bit of betting and friendly gambling did happen socially, but I didn't know anyone who perhaps wagered large sums of money. Not to my knowledge. Unfortunately, I'm pretty certain that it did happen from time to time, from person to person. But that's the difference between social gambling and someone presenting with a gambling related disorder, whether it be mild, moderate, severe, or perhaps even unspecified. And if we're talking about an unspecified gambling related disorder diagnosis, we're talking about someone who is presenting with features of problematical gambling. So we at least want to get that documented, but at least under that, whether it be a screening, an assessment, an evaluation, the practitioner is finding it a little challenging to determine whether their disorder is mild, moderate, severe, or something otherwise. So in this case, it's a little challenging to determine it. We want to be as accurate as possible as clinical practitioners. So we don't want to just document something that is perhaps inaccurate. So rather than do that, we can just list gambling disorder unspecified, or at least place the unspecified specification with that particular corresponding diagnosis to at least document that gambling is something that should be added to treatment planning from an awareness perspective. Counseling sessions should focus on gambling from time to time, in addition to other perhaps co-occurring considerations that are taking place with this particular client. But we at least want to add gambling to the documentation just to show that this is something that is perhaps challenging, difficult, or problematical in the life of the client. We're talking about treatment planning. We're talking about rehabilitative programming. Common forms of treatment for gambling-related disorders include psychotherapy, which centers on interventions such as psychoeducation, cognitive behavioral therapy, solution-focused brief therapy, perhaps even dialectical behavioral therapy, potentially even individual psychology. And there's the list of interventions that could be utilized as far as addressing a gambling-related disorder diagnosis goes on and on and on. There are many options out there. It's up to the clinical practitioner to at least determine and continue to utilize matters from a fluid standpoint as far as the intervention or interventions that could be appropriate for the client. As far as psychoeducation, I'm a huge advocate of utilizing psychoeducation. So now we're talking about gambling. In my clinical practices, whenever I implement or feel as though, at least under the present circumstances, that psychoeducation is potentially the most applicable, what I'm diving into the neurocognitive challenges that manifest themselves during gambling. I'm talking about how that symbiote is activated. I'm expressing or I'm sharing with the client how other matters, other well-being related matters are disregarded when we're involved with gambling. Where we're talking about there's a hopefully an unintentional disregard for what we're responsible for, going back to grocery shopping, going back to rent and mortgage, going back to the tuition of our children. All of those matters are disregarded. So this is where I work with a client and I'll say, as you're traveling, as you're getting their preparations, you're going through those preparations, as far as going to the gambling establishment, traveling to the casino, are we in control? Are we going through some form of dissociation? Are we experiencing depersonalization or derealization, where we're separating from reality, where we are in autopilot, or we are in some form of robotic mode, in which even though we're aware that it's below freezing outside, we grab our winter coat and it's raining, we grab our umbrella, we're walking, so we have to get our wallet, we have to get our identification just in case we're stopped by law enforcement on the way because we match the description of a suspect who was just involved with some form of criminality. So we can at least show our identification. Identification could be ran. As we're going into a casino, we perhaps may have to show identification to make sure that we are at the appropriate age, depending upon the jurisdiction, to be involved with gambling. We're going through all of that. We're making certain that we have our. Now I'm diving into some smaller nuances. We wear eyeglasses because of vision challenges, vision impairment. We have our eyeglasses on. We tied our shoes. We perhaps even put on our wedding band. So we're going through all of these motions. Are you aware of what's taking place? Or are you going through some form of autopiloting as you're going through dissociation, derealization, depersonalization? If you can say you are there, you were there wholeheartedly and the decision was just made, and you were completely aware of the decision made, this is where psychoeducation could be immensely advantageous as far as bringing about a sense of recognition as far as to the client regarding what could take place with themselves or their loved ones having their lives tainted or jeopardized in some manner. I'm a huge advocate even addressing gambling related disorders of utilizing cognitive behavioral therapy. I made mentioning earlier of various criminogenic criminogenic engagements that we could find ourselves involved with. And I even utilize perhaps a bit extreme, but also realistic when I made mentioning of felony murder, as far as someone going through that level of financial desperation in which they've gotten themselves involved in an incident in which now they're potentially facing serving life in prison or perhaps even capital punishment, depending on the jurisdiction, depending upon the state. So what I do here is I will utilize worst case scenario in which we're thinking before we engage in some form of behavior. And I'll ask the client, is this something, despite your history or perhaps lack thereof, of violence, as far as what's documented, or at least as far as what you know you've been engaged in? Is this something, depending upon your level of desperation, is this something that potentially could happen? And this is where I would transition into solution focused brief therapy. What can we do to put this all behind us? From a realistic standpoint, this isn't something that's going to happen by the end of our individual group or counseling session. This potentially is not something that's going to resolve itself significantly during the treatment period. This could be something that we could focus on for the remainder of the current calendar year as we transition into another calendar year. And this is where recommendations are made as far as behavioral health medication management programming or potentially even medication assisted treatment programming, as far as just with the management using pharmacology, as far as the management of neurocognitive considerations, potentially even having medications prescribed to address mood dysregulation in those particular matters. It is important that treatment planning and programming be carried on throughout the individual's life. And I'm talking here is between individual, group, and family counseling sessions in order to lower the likelihood of experiencing gambling related relapsing. Now, there's been times throughout my career in which I've walked away from an individual, group, or family counseling session and said to myself that, okay, that could have gone better or that went extremely well. But regardless of the approach, or somewhere in between, regardless of what happened during that individual, group, or family counseling session, essentially it's not about what's taking place during our 1, 2, or 3 hours together, because we're not going to gambling. We're not going to be engaged in gambling during our time together. Now you're leaving. I may ask along the lines as I'm walking the client to the door, so what do we have planned the rest of the day? The client could share that they're going to work, their daughter have a basketball game later in the evening, their son has a baseball game immediately following that. Now all I can do is go by what they've disclosed and assume that's the truth. But what if it's not the truth? What if our individual counseling session ended at 3:02 p.m. or 2 minutes after, or perhaps even 10 minutes after 3 o'clock p.m. and they're going straight to the casino, which is just perhaps even just 15-minute drive away from my office. And they have intentions on spending the remainder of their day at the casino to go actually going into the very next day. So now we're talking about potentially 8, 9, 10, 12 hours in that environment. So we were just involved with a very, very thorough individual counseling session addressing their gambling disorder severe diagnosis. But now they just spent approximately 10 hours in a casino. So now this is why it's very important for the work that's done for treatment planning to be carried out between counseling sessions. This is reasoning behind why it is a sufficient notion to assert that people in active recovery And like I mentioned with that gambling, there is a form of addiction. So I would like to use that same terminology as far as active recovery, generally being synonymous with substance use disorder diagnoses. But also, I want to use that because of the addictive nature of gambling related diagnoses. Should attend social support group gatherings, including working with sponsorship. And there are Gamblers Anonymous meetings that are held throughout the United States of America, and periodically meet with co occurring treatment professionals. Gambling related disorders should be addressed concurrently with not only other co occurring disorder diagnoses, but morbidity related prognoses as well. In many instances, other diagnoses and prognoses precede gambling related disorders. What I'm talking about here is whether we're addressing some form of anxiety related disorder in a mental health setting, we're talking about some form of alcohol related disorder in a substance use disorder setting, or perhaps even a co occurring substance abuse and mental health disorder environment, or perhaps even in a medical environment in which we're addressing some form of respiratory challenge or some form of ongoing issue, or perhaps even pain management programming stemming from a construction accident or some form of motorcycle accident. Those matters generally, as far as diagnoses and prognoses, proceed or prioritized from a more substantial basis in comparison to a gambling related disorder diagnosis. In my clinical practices, I do not believe I've ever worked with a client in which they had a primary diagnosis of gambling disorder moderate or gambling disorder severe. They were diagnosed and they didn't meet criteria for a corresponding gambling related disorder, but that was more so much further down the lines as far as being tertiary, or perhaps even not even tertiary, something along the lines that was supplementary or additional or other or unknown as far as where it lies as far as prioritization regarding that particular diagnoses. They were documented, but as far as my clinical practices, I do not believe I've worked with someone in which their gambling disorder mild diagnosis was their primary. Now again, it was documented and it was addressed proportionally in comparison to their other diagnoses, but as far as it preceding their other diagnoses, I do not believe I've ever come across that. But perhaps even with those particular clients, their gambling disorder diagnosis was not something that was their primary or secondary or perhaps even tertiary. Potentially, maybe their schizophrenia related diagnosis was something that was the primary. Perhaps even their amphetamine related disorder diagnosis, or perhaps their hallucinogen related disorder diagnosis, or sedative, hypnotic, or anxiolytic use disorder diagnosis was more along the lines of being the primary or secondary, or perhaps even tertiary. But at least, regardless of where a gambling related disorder lies, as far as being that primary or secondary or tertiary or supplementary or other, I at least wanted to put this presentation together to bring awareness, particularly of the addictive nature of gambling, and how even if someone's not involved with any form of chemical abuse, that level of addiction is proportionate, and it can, and it has, and it will consume the life of someone who's presenting with or endorsing features of in this case, we're going to say a gambling disorder moderate diagnosis. This could have bearing on clinical practitioners not addressing gambling related concerns as proportionally as other clinical diagnoses and prognoses. And in clinical settings, I came across some contemporary research a couple of years ago in preparation for this symposium I was involved with. And it was presented to me as I was getting myself prepared for that particular symposium that gambling related disorders, just like tobacco use disorders, are not proportionally addressed or attended to in comparison to other clinical diagnoses and prognoses. And that preparation, even though this was just a couple of years ago and I've been working in the field for much longer than that, it brought a level of awareness to me. I said to myself, as soon as I get back, as soon as I return from this symposium, I will go down the list. And this is something that I'm very proud of doing. I will work with each client to see where they're at as far as their gambling, as far as their tobacco use, get those particular diagnoses at least added to their treatment plans, and identify the appropriate time as far as individual, group, or family counseling sessions to address those particular diagnoses and prognoses, just to make certain that every matter that's all encompassing, every matter, every diagnosis, every prognosis is addressed at least proportionally, to make certain that everything is being tended to from a simultaneous standpoint, so the client is not potentially having one lingering diagnosis that's still there, particularly a diagnosis that's of addictive nature that could perhaps even trigger psychiatric episodes, even though we've worked so diligently to address the other diagnoses that were outlined in their respective treatment plan. We have reached a point in which this presentation will be coming to an end. I really would like to thank you all for taking part in this presentation. If you have not already done so, consider subscribing to our YouTube channel. Also contemplate liking this presentation and select the notification bell, which helps with continued channel growth, and so you can be notified when subsequent presentations have been uploaded. I sincerely want to thank you all for taking part in this particular movement. If you have time, review the website for Dr. Curry and Associates, which is www.drcurryandassociates.com. Share all of this information with someone you think could benefit from it, with something here, elsewhere on the channel, or on the website for Dr. Curry and Associates, possibly helping someone progress away from addictive, antisocial, problematical behavior. Again, I truly want to thank you all for taking part in this presentation, and I will catch you the next time around.